Assalamualaikum and hi guys. My name is Nur'Aliah Aqilah binti Fawzi and my metric number is 208271. And my partner is...
Hello guys, my name is Nurhanis Safia Binti Junaidi and my metric number is 207282.
Now we will begin our presentation. What would you do if you had panic attack when reading news about COVID-19? Would you do nothing? The World Health Organization defines mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Me and my partner plan to talk about the methods to cope with mental health issues during COVID-19 pandemic. I have done a lot of research about mental disorders such as schizophrenia, since I am very exposed by it. If you guys have not heard of schizophrenia, it is actually a mental disorder where you hear, see, smell, and also feel something that's not real. It happens to men at their 16s while women at their 20s. This presentation will be divided into 4 parts, which is the introduction, 2 methods to cope with mental health issues during pandemic COVID-19, and the conclusion. The first method to cope with mental health issues during COVID-19 pandemic is by taking good care of your mind and body. The way to take good care of your mind and body is by having a good rest. Good rest means quality sleep. Sleep plays an important role in having good mental health. Correct amount of quality sleep boosts ability to learn and process memories. Not enough sleep causes difficulty in concentrating. The guidelines for quality sleep by National Heart, Lung and Blood Institute mention that preschool-age children should sleep 11 to 12 hours, school-age children 9 to 10 hours, while adults 7 to 8 hours. The second way to take care of your mind and body is by take time to relax. Stress affects our mental state by elevating level of cortisol, resulting in worrying, poor concentration, difficulty in making decisions, and uncontrollable thoughts. Relax slows our heart rate, reduces our blood pressure, and relieves tension. When we relax, the flow of blood increases, causing calmer and clearer mind, which aids positive thinking, concentration, memory, and decision-making. There are several ways to relax, such as listen to music, talk to a friend, and read a book. Now I will pass to my partner.
Thank you, Alia. Now let us move to the next main point, which is practice a healthy lifestyle. So in this part of presentation, I would like to explain on how to practice a healthy lifestyle that can help us in coping with mental health issues during this pandemic COVID-19. Firstly, we need to eat healthy and well-balanced meals. So eating healthy food promotes the growth of good bacteria, which in turn positively affects the production of chemical transmitter that released by the nerve cells that we call as neurotransmitter. When neurotransmitter production is in good shape, your brain receives this positive message loud and clear, and your emotions will reflect it. But when production of the neurotransmitter goes awry, so might your mood. According to Dr. Gabriela Cora, a board-certified secretary said, when you stick to a diet of healthy food, you're setting yourself up for fewer mood fluctuations, happier outlook, and also improve your ability to focus. So, in order for you to boost your mental health, you need to focus on eating plenty of fruits and vegetables, along with foods rich in omega-3 fatty acids, such as salmon. Another food that I could recommend are dark green leafy vegetables. In particular, are also brain protective. Nuts, seeds, and legumes, such as beans and lentils, are also excellent brain foods. Okay, we go to the next point, which is we need to exercise regularly. According to the Journal of Occupational Therapy, it shows that exercise can contribute to improvements in symptoms, including mood, alertness, concentration, sleep patterns, and also psychotic symptoms. When we talk about it in terms of the biological mechanism, exercise has been shown to cause changes in certain chemicals that we call as endorphins. So endorphins are the feel-good chemical messengers that help relieve pain and stress during the exercise. Hence, exercise can improve mood and reduce symptoms of mental illness, such as depression and also anxiety. According to James Blumenthal, a clinical psychologist at Duke University, there's a good epidemiological data to suggest that active people are less depressed than inactive people. So it brings us to the conclusion. So I would like to summarize our presentation. My partner already explained one of the main ideas, which is taking good care of your mind and body by having a good rest and taking time to relax. I also already presented the second main idea, which is practice a healthy lifestyle by eating healthy and well-balanced meals and exercise regularly. So before I ended the presentation, I would like to share the words of United Nations Secretary General Antonio Guterres. We are in this together and we will get through this together. You and I, we are not alone. Hence, do not be afraid to reach out to people and take appropriate ways to cope with mental health issues during this pandemic COVID-19. Well, that's all from me and my partner. Thank you very much.